Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain body connection and learn how to optimize your health.
This episode is going to be a little bit different. One of the questions we had is, Dr. Z, what has led you to where you're at? What inspires you? And we just want to know more about you. So I'm joined by my wife, Sarah, who's going to interview me and help you learn more about who I am and answer some of those questions. So here we go.
Okay. So 2024, we started it in freezing cold Idaho. We ended it in very sunny, beautiful weather, Tampa area, Florida. So what made you decide to switch your clinic up?
So we got the new clinic, Peak Brain and Body, here in Tampa. Now, I work with a lot of people who deal with cognitive decline, who are either in dementia or heading to dementia. And one of the most important things when you deal with these individuals is they've got to be active. You just have to be active. And as I would talk to them, I was like, guys, like, you've got to become more active. And I was like, and they're like, but it's so cold here for most of the year. They're like, summer, I've got no issues. But for 6 months, 7 months, it's just not nice enough to do anything. I was like, crap, like, they're right. You know, I wasn't as active as I would like to be. So that was part of it, was long-term health, right? Where are we going to be the healthiest? But then the other part was, I've got 5 girls. And when we went on trips to places where it was warm and they could play in the water, they were so much happier than they've ever been. Now, that's not to say there weren't times in Idaho they were happy, because there was. But when was it? It was during the summer when it was warm. Once it got warm outside, they behaved differently and everything else. So it was about getting them to an environment where they could just be happier year round. And for them, that comes from activity. Just like for us, places we can be more active. So that's how we ended up in Tampa in 2024. I made that transition in 25 and ultimately shutting down a physical location where I was helping a ton of people in Idaho and was doing really, really well.
Awesome. I am really excited for this. I hope you're really excited for it too. So let's get to know you a little bit better. So growing up, I wanted to be a radio DJ. What was something that you wanted to do? I know little boys usually tend to be like firefighters, police officers. What did you want to do?
Yeah, so I was not your typical little kid who wanted to be a firefighter, police officer. You know, I think there was a little period there where I wanted to be a pro soccer player, but I don't know that I ever dreamed to that level. Somewhere in elementary school, I wanted to be an orthopedic surgeon. Don't ask me how a second or third grader decides they want to be an orthopedic surgeon, but I played sports. You know, there was lots of injuries, and well, orthopedists were the ones that dealt with those injuries. So I was like, cool, you know, I can be someone who deals with these injuries. And I really stayed on that path for most of my schooling. Like, that's what I wanted to do. It was, hey, I'm going to be an orthopedic surgeon.
Okay. So you're obviously into medicine now. Is that something that ever wavered, or kind of was it always something like, this is the plan, high school, college, this is what I'm doing?
Yeah, so I'm clearly not an orthopedic surgeon, right? Would I have been happy doing it? Probably. Is it something I could even do at this time? No, not really. You know, so something a lot of people don't know about me is that I've got chronic back pain. I've had chronic back pain since the age of 20, and there's no chance at all I could stand and do a surgery. If you ever have a conversation with me in person, if you pay attention, you would notice that I don't stand in one place for any more than about 3 to 5 minutes. I shift my weight, I move around, and I have to constantly adjust, because if I don't do that, I'm in pain. So needless to say, didn't become an orthopedic surgeon, but there was something else that happened. I was visiting someone in the hospital, had what was, termed a seizure or seizure-like event. And after that, really, I was kind of developing anxiety and panic attacks anytime I go into a medical setting. So I didn't go to medical school. And I really kind of went through this phase like a lot of people do when your life dreams eventually die in an instant. I was like, man, what am I going to be? Right. So I was like, oh, I was interested in political science, did some studying there. Well, maybe I'll go and be an attorney. That's something people do, right? If you're told you need to be successful in life.
You could have fit in my family if you did.
Yep. And really had no interest in any of those. And it was along the way with my chronic back pain, went to primary care doctors, went to everyone. But I was just this catch up patient, like what's this healthy 20-year-old, 21-year-old doing in our office who's got back pain? They'd rarely even make eye contact with me. It was like, well, here you go. This is what you've got. Because also with some of that anxiety that developed when I was in closed spaces, I was actually developing anxiety. So I actually bailed out of doctor's appointments. If I was left in a room too long, it would get hot. I'd start feeling icky to my stomach. I didn't actually realize it was anxiety for a while. But, they'd come in, they didn't even make eye contact. I was like, okay, I'm clearly the catch-up patient, where it was 2 to 3 minutes because I looked healthy. And I then would go to chiropractors. And I'm not going to say I got answers and got resolution, because I didn't. But they would talk about the body working as a whole unit. And I was like, well, at least there's something there. They're spending more time with me. They're really trying. The others were just, I was in and out super fast, and it was medication, physical therapy, injections was really all that there was. But, there wasn't a lot of, let's
Care.
look at the body as a whole and let's really care. And I felt that at least the chiropractic side, the ones I interacted with, I understand they're not all this way, but they at least seem to care more and were open to trying a lot of different things with me beyond just being like, well, just go back to the doctor and get more medication.
I remember when we first got married, we had just moved to Nebraska, and your back had been hurting so much that we drove 14 hours back to Utah to just get these like shots, because at the time it seemed like the only thing that could alleviate the pain somewhat.
Yep. And, the injections, they work to a point,
But it never solved.
It definitely never solved anything. And it was like, well, do I want to be on injections the rest of my life, every year and a half? Because the injections usually weren't considered long-term. And it was like, man, there's just got to be something better. And it was obviously worse when you're in school and you're just sitting down all the time, because when I do sit, I get out of the car after 2 to 3 hours like a 90-year-old. Where I've got to stretch and everything because I tense up,
stiff.
right? So I've got to be like shifting and everything else. So
I know you deal with a lot of patients that it feels like they're their last hope. Is that kind of why you do what you do now, or is there something that influenced you to? Am I getting ahead of myself? Well, I also wanted to ask too, maybe we can go back to that. You also said that you had doctors who didn't really believe that you were in pain because you were so young and you looked healthy. What about everyone else, like family members, friends? Did they seem to think the same as the doctors? What was going on with them?
yeah, it was really puzzling for people, because here I was. I couldn't, if you wanted me to kneel down and just be on my knees for a period of time, couldn't do that. If you wanted me to stand in a place, I couldn't do that. At its worst, like if I ran on a basketball court, the pounding hurt, but I could run on grass. And so I had people who were like, man, is he just trying to get attention? Is he making this up? because it doesn't make sense that you could do this, but yet you couldn't do that. And even now I'd say like partially like, yeah, it still is kind of confusing that, I could do certain things versus others, like I could do things and be physically active in certain environments. Once again, right? Grass, probably because the ground was a lot softer than doing a basketball court. Basketball court was not something I could run on for a long time without getting back pain as well. And so, yeah, there were definitely people who were like, you're making this up, you're seeking attention. And that was frustrating because
you're in all this pain and no one believes you.
Why would you fake that? Why? It doesn't make sense that you would go through so many different things when you've never done that in your entire life, right? Playing sports, ankle injuries, torn a hamstring, which was because I played when I shouldn't have.
I was gonna say, you were playing soccer since the age of 4, right? Like you've always been active in some kind of sport.
Yep. Always active, played sports, right?
So to go from soccer to all your life to, oh, now he's hurt. Like, even though you're still playing, because I know when we got married, you still had back issues, but you were playing like ultimate frisbee. You were playing on soccer teams.
Correct. I could do things if I was moving. After that point, I had already had some injections, which did make it so I could do things a little bit better than I previously could. But it was still challenging because I would lock up if I was in a place for too long. I remember one physical therapist who you actually worked for.
Yes.
He was doing something, measuring the tone of my muscles, basically. And he had me stand up and then lay right back down. And he was like, you've got to be kidding me. He was like, everything I thought I was accomplishing, I am not accomplishing anything. And it's because that's how essentially imbalanced the muscles were in the body. And so at that point in time, he gave up and said like, hey, you know what? I don't have anything else for you.
So you said just dealing with the chiropractors made you decide to go at least if I'm going to do medical, I can just do chiropractic, correct?
Correct. Yeah. Because, there was something about the hospital setting that I was afraid of. I had an ingrown toenail that cut out, had another seizure-like event. Really, I just kind of blacked out, right? Because I was watching it all. But at that point, I swore off okay, well, I can't go in a surgery because I knew that'd be part of it. And with chiropractic, well, blood wasn't necessarily something that you were going to have.
Mm-hmm.
And I was like, well, maybe I can do sports chiropractic. And so needless to say, I did go to chiropractic school. And while I was doing those classes there at the school, the first class in college I ever actually liked was anatomy and physiology, which most of you are like, you gotta be kidding me. Because usually anatomy and physiology is not a class that people would put as their favorite class they ever took in undergrad.
I took it.
But for me, I loved it. I absolutely loved anatomy and physiology. So I was like, cool, I'm on the right path.
Okay. So you're in chiropractic school. How was it there that you discovered functional medicine, like the brain, because usually chiropractors don't tend to work with the brain. When you think of them, it's adjusting. How did you find what you do now?
Yeah. So one of the big things in chiropractic is they would always say the master system of the body is the nervous system. And now this is going to vary a little bit depending on the school you go to. So I went to school in Dallas known as Parker, and I was actually on my way out. I was 2 semesters in to chiropractic school, and some of the loudest people were those that were very philosophical based, which was, hey, you adjust, you put an impulse into the body, the blah, 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 right? Everything happens. You don't have to worry about what happens. You're just doing these stuff to make boards happy. None of this stuff really matters. And I was like, this is like a religious cult. And I was actively looking at different options because it's like, these guys are nuts. And while I was looking, someone posted one day a video in our Facebook group, I was like, hey guys, check this out. I was like, okay, cool. Like I'm probably going to leave chiropractic school anyways. I've already paid for the semester, so I'll stay, but I've got to find out how to tell my wife that I'm going to leave. Because she didn't know that I'd been looking at it for at least a few weeks.
I would have supported you in your decision. I would have been freaking out, but
I
would have supported you.
And I watch it, and it's this video of someone helping these individuals who were struggling with a wide range of neurological based issues, dizziness, concussions, and stuff in that whole arena. And instead of me coming home and like, hey, I'm leaving, I was like, by the way, there's this group that does some cool stuff, and they actually do seminars here in Dallas. I'm going to sign up for all of them, not just do one and see how it goes. Nope, I'm going to prepay for all of it, right? $5,000, which was a lot of that time.
Especially because I believe we just found out I was pregnant with our oldest as well.
So it's like, yep, we're going to prepay so we can save a little bit of money. Like, I'm committed. It's this or it's nothing. So
how was your first seminar?
First seminar was rough. It was rough.
You didn't understand everything completely.
Correct. You don't understand everything completely. And, a little bit about me, my favorite movie, like pretty much of all time, it's the Rocky series, like Rocky 4. So whenever I did the first, that was at least the first 5 or so seminars, I felt like Rocky when he was fighting Ivan Drago.
You texted me that too.
Like I was just getting roughed up. I was like, I don't understand what these people are saying. There's no way I'm ever going to learn this. This is too complex. And you know what? Over 90% of the people who start those seminars, they do not finish it. They do not get their diplomate in chiropractic neurology because it's not for the faint of heart.
But you had to. You prepaid.
Yeah, I prepaid, and it's what made sense. If the nervous system is really the master system of the body, then we should understand how it works. And so I dove in, and I was doing that every single month. And I was actually spending more time in school studying neurology than I was pretty much anything else. If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying.
So you're taking these seminars and a clinic decides to open up based on these seminars, correct?
Correct. Yep.
Yeah. And so you decided, well, you joined the Parker University Neurology Club. Is that what it's called? Or
Yep. Yeah.
So you joined that club and they reached out to you guys, right?
Correct. Yep. They reached out to get some interns who could come in there, and volunteer and help out as the clinic was opening. And then even it kept going after the clinic had opened.
Mm-hmm. So did you meet anybody there that kind of influenced you, like to keep doing this, like to gain more knowledge in this, like, or was it who influenced you while you were there?
Yeah. So it was a really good experience because the patients we saw, we were in Dallas at this point in time. They were flying in from other states. They were flying in from other countries. I've worked with UFC. I've worked with NHL. I've worked with NFL, current people at that point in time, Hall of Famers, right? People who have their own TV shows, people who've had movies made about them, billionaires. Like I've worked with the top of the top people. And I've also worked with people who put together fundraisers to make it happen. And many of these individuals had seen at least 10 different providers, if not more. And to see people get results in as little as 1 week, even though they'd struggled for years, it was my mission to change people's lives because, even if I wasn't able to get the answers I wanted for myself, I knew how bad it sucked to not get better and to see people predictably get better. And that was the key. Predictably. It wasn't just a fluke like, oh, people were coming in, we had a great sales system and we'd help 1 out of 10. No, it was like 80% or higher were getting results that they were happy about. Now, one of the main, there were a few different doctors there, but one of the main instructors for that group, so it was the Carrick Institute, who we did chiropractic neurology through. One of their main instructors at that point in time was Dr. Brock. And I was kind of paired with him, and there were some other doctors there as well, Dr. Rand and Dr. Shores, and then Dr. Perdue, who was a medical neurologist. So, but I'd say Dr. Brock definitely had the biggest influence on me because he did both sides. He wasn't just neurology. He was also very functional medicine and integrative. And those who aren't really familiar with functional medicine, it's about how the body works and identifying where the breakdown's occurring is ultimately what functional medicine is. It's what's preventing the body from working the way it should. And he told me, like, well, if you really love the brain, it's not enough to understand the brain. You have to understand what influences the brain. That is how you're going to help the most people. Because most people, they don't really study both. If you've been to a specialist, the neurologists, they usually aren't the most versed on what interacts with the brain. Like if you ask them like about gut health or about hormones or about thyroid or about liver and the brain, they're like, that's a different provider you need to see. And so it's very disjointed. So Dr. Brock was definitely one of the first people that had a profound influence on the path I took.
So Dr. Brock, very smart. The second that you told me that he was not only a chiropractor, but that he was a nurse practitioner, I knew that you were going to want to go to nurse practitioner school. I don't know personally, I didn't know if you actually were thinking about it, but in my head, I was like, well, maybe if I don't say anything, you won't want to go to nurse practitioner school because there was more schooling than just chiro to nurse practitioner school. And we had just done a lot of it. And we had just gotten into a lot of debt. So I'm like, maybe if I don't say anything, he won't want to do it. But obviously, you did go to nurse practitioner school. So when did you decide that you needed to do both?
So it was towards the end. It was probably within the last 6 months of chiropractic school. And before then, it was about 6 to 9 months before then that I was tossing it back and forth in my mind. I was talking to Dr. Brock. I was talking to other chiropractors. I was talking to the medical director, Dr. Perdue, who's a medical neurologist. And I was just going back and forth, because chiropractic scope varies depending on the state you live in. There's some things you can do and there's some things that you can't, really depend on the state. And then there's some things you just can't do in general.
And if you're wanting to go functional medicine side,
yeah,
a lot of what chiropractors do technically isn't
correct.
covered.
If you really want to do functional medicine, you really need to have that medical licensing, because about half the patients we worked with in Dallas were military veterans. Lots of them were Navy SEALs and other special forces. And if you know people who've dealt with traumatic brain injuries, who've had concussions, they often end up on psych meds. They do. And we had people coming in with side effects from their medications. And as a chiropractor, you can't actually talk about it. We'd also be doing labs on them. With a lot of these blast injuries, their testosterone levels were pretty much non-existent or very low. Once again, not something I could address. And with my personality, guess what? I wanted to be able to address the whole picture. I didn't want to have to send them back to the VA that they literally just spent the past 30 minutes telling me how much they hated the VA. I couldn't be like, oh, well, you need to go back there and hope that they would address it
or agree with even what you recommended.
Correct. Or even agree, because there's plenty of people who are like, oh, that's stupid, you just need to stay on those meds. So I went back to school so I could de-prescribe most people. Now, every now and then, I do put people on medication, but it is mostly to deprescribe, because a lot of people in the brain health world, they are put on medications to treat side effects of what's going on versus to treat what is actually going on.
So what was the whole process that you had to do to become a nurse practitioner? Because it's two completely different pathways in education.
Yep. So during chiropractic school, because that's when I decided to go back, and I knew if I took a break, I may not go back.
Mm-hmm.
And if I did, it was going to be a lot harder.
And we also had 2 kids by this time.
Yep. And so I started nursing prereqs while I was still in chiropractic school. So that last semester I started it, did some more in the summer, and then I went to nursing school. So you have to get your bachelor's in nursing. So I did that. That took me 4 semesters to do.
You did, because you did the accelerated.
Yep. So 4 semesters, nonstop, no breaks to summer, which, mind you, I'd already just done over 3.5 years of no breaks in schooling. Maybe it was 4 years, right? Whenever I look at the other undergrad I did.
Yeah.
But it had been a long time without a single break. But I did it, started it, went through, I was working at a clinic initially 5 days a week, and then doing hospital rotations 2 days a week for nursing school. And then I finished, I switched jobs to a place where I wasn't going to die. And, I was working 3 days, 3.5, 4 days a week while doing nursing the other 2 days a week, working through that.
So you said that you were doing your rotations or clinicals at a hospital. Did you have any issues come up from your past experiences? You said you were afraid to be in the hospital sometimes, or got panic attacks.
Yeah. So I was very, very scared to go to nursing school because of the hospital experience, but I also knew I wasn't going to be happy. So I was like, crap, I'm literally going to take this gamble on what's going to happen. And so I did. I took the gamble because I had to pay for it in cash. There was no student loans. There was nothing like that I could get because of the way chiropractic school was. And I did well. There was one thing where I started feeling a little off, and it actually didn't relate to blood or anything like that, because I did a wound care rotation, which was awesome. I actually really, really enjoyed wound care, and you see tons of stuff in there that if you just have issues, you would have not done well. But no, the one scenario was actually someone who, they were teenager, upper teenage, and we were doing a dressing change, but it was the amount of pain they were in. So if I look back, it was in that prior time, I also felt bad for that person. There was like this empathy thing with watching teenagers struggle and kids struggle. Really hits me hard. I don't like it. No. Whereas people are like, oh, Dr. Z's not emotional at all. Like, I don't like that. It hurts.
Okay, so you got through the hospital. You did nurse practitioner school. And then what happens from there?
Yep. So I did nurse practitioner school, and I had a different rotation than most. So I actually had part of my rotations were done in the hospital, which is very rare. While I was doing that, I worked on a stroke unit as well as a nurse, but finished up all my rotations and then ended up moving to Idaho. There was a group that I got introduced to who were needing someone that could do concussions. So I did that, built a clinic up over 6 years, and I worked with a wide variety of things: concussions, POTS, dysautonomia, long COVID, chronic dizziness, chronic migraines, mold issues, Parkinson's, a lot of different things. And people are like, oh, how can you help so many different things? Well, it goes back to my initial teaching in training. You have to understand how the body works as a whole. If you truly love the brain, you have to understand what the gut's going to do to the brain. And as you learn about the gut, well, now you can help these gut issues because you've learned how the body connects. And so
cause and effect.
Correct. Cause and effect. And it's not very disjointed, because you can refer to someone But if you refer to someone who doesn't understand the connections, you both find what you find, but then it's like, well, I found this, I'm going to treat it. And it's like, but is this the right order? Because one thing can influence something else more. But if you only have experience in one area, you don't actually know what should be treated first. You're just like, well, I found it, I'll treat it. And if it gets better, it gets better. If it doesn't, it doesn't. But that makes things less predictable. So needless to say, had a really good clinic in Idaho, very successful. I even did some expert witness stuff in court on concussions. And, I saw people from all over Idaho, also had people from other states. And yeah, I even testified for chiropractic to be able to return athletes to play. And had it not been for COVID, one of the legislators actually wanted me to help them change chiropractic care in Idaho because based upon our conversations, they knew that the care these athletes were getting, it was very subpar compared to what it should be.
Okay, so I have a two-part question. So one, was there a favorite patient that you had when you were interning at Carrick? And two, is there a favorite? You treat so much stuff. Is there a favorite that you have, like that you prefer one over the other, or is it all the same for you?
I don't know that I had a favorite patient at Carrick.
Okay.
There
Or
was
favorite type, or
there was a lot of them that I really enjoyed. Even in Idaho, there was, the lots of fantastic patients. But for me, yes, I remember the ones I help, but the ones that I never forget are the ones that really, really wanted to get better and I couldn't.
Mhm.
Those leave scars.
Those, just from knowing you personally, those are the ones that keep you up at night. Those are the ones that make you study harder. Like they kind of push you to study more, do more research, to know everything that you can, because that's your type of personality is you want to know everything. Like you don't like being wrong.
Correct. And even though I helped, 80, 90% of the people I saw who followed through with what I asked them to do, who did better, it was that remaining 10% that it drove me nuts, and it hurts because when people come in and they tell you you're their last hope, you can either kind of disconnect from it or you make it your mission to do it.
Do you kind of see yourself like you're the patient that couldn't be helped?
I don't know if I see that. All I know is I hate having to tell people who are good people that there's nothing that can be done. And it's also hard because I see so many of these people, they've been, I don't want to say scammed, but they've been misled. Like, if you're a hard case and you deserve to be told, like, hey, this is really, really hard. I've had people who don't get care because I told them, look, you've told me this, you're going to be a hard case. Maybe there's only a 25% chance I can help you, and who won't get care because they want to be told there's an 80% chance, even though there's some things that are just super, super complex, and we shouldn't oversell what we can do. So I'd say that's part of it, is I want everyone to get the highest level of care. And I'd say maybe there's parts of it where maybe part of it's selfish, but there are those who have jobs and there are those who grow from what they do. Every time I help a hard patient, I grow. When someone comes in and tells me about what they've been through and they share with me their journey and then they improve, you can't help but to become a better person, especially when you work with these neurological based injuries and stuff, and you start seeing people get their lives back and who are thrilled with what they've got, even though they'll never be where they ideally would have been had the injury not happened. But seeing that gratitude, it changes you. Like we're so caught up in so many things in life that we're ungrateful beings. So many humans, we're just ungrateful. And when you see those patients on a routine basis, and I saw a lot more of those in Dallas with the severe brain injuries compared to Idaho, but it just, you just come home and you just view the world differently. We just have been taught almost in our culture and society to let these little things be big things. And so we take for granted so much in life that we shouldn't take for granted.
Mm-hmm. So, do you have any regrets? We had a successful clinic in Idaho, starting from scratch in Tampa.
So one of those things, right? Like, sure, there could be some regrets, right? I wish I could have found a way to have kept it open. But you learn along the way, right? I made mistakes with providers I hired. I went about it wrong. But everything is a learning opportunity, right? Like, sure, if I could go back in time, would I have went to med school from the very beginning and just been a medical neurologist? Sure. But would I have learned anything I've learned? No, because I would have been told it didn't exist. Because that's what the medical neurologist at Carrick, he would tell patients that, like, hey, he's going to change your treatment plan. Just go with it. Okay. We're not taught this in medical school. We're not taught this in our neurology residency and fellowships. They're doing things that are considered not to exist in medicine.
And they're getting results.
And we're getting results because we're using a different approach that now you start seeing more and more people are doing it to a level currently. But whenever I was first taught about it, it was just like, dude, this stuff doesn't exist. Like, you guys are nuts. It's like, well, our results say otherwise. And so it's been great to be ahead of the curve.
So no regrets.
There's always some degree of regrets. It's just trying not to let them control you.
And there's definitely people and patients that we will miss in Idaho, but looking forward to build new relationships here.
Yep. Building new relationships here. I'm committed, no more school. I do a ton of continuing education, but yeah, no more school. I did think about going back to med school.
No.
And it was literally just for the haters. The people are like, oh, well, you're a chiro, and they'd ignore the fact I was a nurse practitioner. And the more I thought about it, I talked to a lot of medical doctors and DOs, and a lot of them were like, dude, and this isn't me trying to toot my own horn, but they're like, dude, you're smarter than most neurologists I know. I would send my family to you before I'd send them any to there. And it was literally going to be me to go and get a credential,
a title, yeah,
that would have actually put me behind, because
you wouldn't be able to treat patients.
You don't treat patients. You have to do all the 4 years at the beginning, so you're not able to treat patients as much. But then when you're doing residency isn't about being cutting edge. Residency is about doing the highest level of the standard of care. It's not about saying, man, here's the latest research, let's go. They would say, you guys are jumping the gun. You can't do this yet. And that's one of the reasons we're able to help so many people is we're always trying to say, what does the research show? Now let's apply it clinically as soon as we can and see what the outcomes are. Because if we're limited and only providing what's considered standard, then I have to tell people what they've been told all along is, hey, there's nothing that can be done for you.
And me personally, I'm glad you didn't, because our oldest would have been graduating high school the same time you would have been done with your MD. Do you remember what I told you when, or saying to you when you wanted to go back to med school?
I mean, I know you were tongue in cheek. You were willing to let me do it.
Mhm. But I took Taylor Swift's "We Are Never Ever Ever Getting Back Together" and changed it to "You Are Never Ever Ever Going Back to School."
So
Hope that didn't happen.
yeah, but I was close. I mean, I was really, really close to pulling that trigger, and honestly, it was picking to be a parent over a provider. Because for most of the time, once again, I love what I do. I don't, you're not going to truly get that from listening to this. When I first opened the practice, I did way more trips for continuing education than we did for family vacations. Mm-hmm. And it took some deaths of people around us for me to be like, life is too short. I need to do stuff. And even listen to another podcast where someone was talking. And I was like, man, if I go back to school, if I don't change what I'm doing, my kids are going to remember me for being a great provider and doctor. But they would probably always think our dad loved his patients more than he loved us. And that was the point where I was like, man, I've got it. I can't go back. Because that would be the message I felt I would have been sending. So
let's do little fun questions. Okay, so we have 5 girls. This is the question that we get the most. So, are you going to try for a boy?
Nope. We've got 5 girls. We're done.
We got a boy dog. He counts, right?
Yeah, he's one of the. He'd be the one sitting on the sidelines, not getting any game time though. So that's
okay. Favorite sport?
Favorite sport was always soccer. Loved playing soccer. Still love watching it. So soccer's probably number 1.
Soccer. You actually were thinking about being a kicker in college, huh?
Correct. Yeah. One day I walked out football, and I was stroking it from 55 yards. So I was able to do 55-yard field goals, and try to walk on a 1 team. They didn't actually care about their tryouts. It was just more of to say they did it. But yeah, I was out kicking their kicker, and
who was actually playing in all the games.
Correct. Yep. And so I didn't, ended up going to chiropractic school, and some other stuff happened that, so I didn't actually end up trying out again. But yes, I had a really, really good leg.
Favorite team?
Favorite team in soccer, I'll go back to what it used to be, even though, they're kind of disappointing. Manchester United. So Manchester United, back when they had Rooney, Tevez, and Ronaldo, was about as dynamic as it got.
Favorite color?
Favorite color has always been blue.
He looks good in blue. Coffee or tea?
Probably tea over coffee, other than when we were in Bali, we did have some good coffee.
The coconut coffee?
Coconut, avocado, and vanilla.
If anyone knows how to get a hold of that, let us know, because we are almost out, and I'm really sad about that.
Yeah, but the regular coffee, just not so much.
Okay. Let's see. Favorite place to vacation?
Well, we're new on our vacation journeys. We are. As a couple, it was Fiji was amazing. And then with kids, honestly, Florida Keys was, I'm going to say, number 1. Mm-hmm. But anywhere where it's warm and they're active, right? So like Idaho, the water was too cold when we'd go camping, or else that would have been amazing, because I do love the mountains. So I would say even if we did like North Carolina, Georgia, Tennessee in the summers, now that we're here, those are going to quickly hit the list, because the kids love hiking and they love playing in water, and having a place where they could actually do both is going to be hard to beat.
Okay. Favorite outdoor activity?
Favorite outdoor activity. Oh,
I know
man.
you love the outdoors.
In the water, I love kayaking or rafting. That's great to do. And then, yeah, I mean, that hiking,
Camping.
I love camping. Not going to do much of that here in Florida, though.
So,
And then, of course, playing sports.
what's your favorite thing to do with your kids?
Favorite thing to do with the kids? It's camping. Camping, being in the outdoors with them by far.
You taught them how to, our oldest how to light a campfire, and even how to, like, the little ones how to saw wood.
Yep.
Or let's see. Anything else? I'm blanking right now.
So, but yeah, so those are just some random questions, about stuff about me. And once again, we're in Tampa. This is going to be our forever home. We're done moving unless we can find a way to swing Fiji. But,
I would love that.
But it's going to be here. And the goal is to really pick up where we took off and to become the premier place for people to come with neurological based issues, also chronic and complex immune based issues. So I love those, and really bring full care to people. One of my beefs with natural medicine is we talk about holistic care, but no one actually evaluates the brain ever. Like, oh, well, holistic care. It's like, well, no, you look at everything but the brain. And that's why the clinic grew so fast in Idaho, is because people come in with chronic fatigue, brain fog, headaches, and everyone was trying to do it from a gut perspective or from a hormone perspective. And it was like, for some of those people, that was part of the puzzle. It's part of what needed to be addressed, but it wasn't everything. No one actually looked at their brain health. And whenever we looked at their brain functionality and we addressed that, and then we layered it in, then people did a lot better. So always compare it to like playing music. If you have the singer, the drummer, the bass guitar, regular guitar, right? If they're all four are doing what you want at the same time, you get the best outcome. But if they're doing it louder, quieter, faster, slower, they're out of sync, out of rhythm, they're not in harmony, you don't get the results you want. Even if most of them are doing their job right, you need them all operating effectively. And that's one of the big special things that we're going to keep doing, is that side. And then one day my goal it's to train other providers to really put the body together, because I had the one mentor up front, but now people ask me, like, who are my mentors? And it's like, well, for what? Because I have multiple people that I learn under, because there's not just one person who really integrates it all in the way that I've done it. And that's also why, I do spend a ridiculous amount of time studying.
You should see how many books he has. It's taken over our closet.
So, yeah, if you've got other questions, let us know in the show notes, whenever you comment. If you have things you'd like me to cover in the future, let me know. This is just one of the many episodes and shows that we are doing. I'm having, I'll do shows where it's just completely me talking about a variety of topics. But I'm also doing others where I'm getting experts in the field, whether they're medical doctors, DOs, PhDs, chiropractors, trainers, whatever it is. And we're going to talk about a lot of different things, because there are many different ways to view health, and there's many options out there. But the biggest thing is people aren't aware of what options are available.
Yeah.
When you turn on the TV, all you see is insurance commercials. You see medication commercials. You don't see the commercials that show you how you don't need those medications to begin with. And so there's a lack of awareness out there. And our goal is to really change that awareness and to bring things out of the shadows, because it's not that things aren't there and they don't exist. It's that there's not an awareness. And that's really the goal, is to change that.
If you could tell a patient or a person who's on the fence about getting care, what would you tell them?
If it's something that I believe I can actually help, do it. I'm not going to lie to you. I'm not going to tell you 90% if I think it's 20%. You know, I've lost plenty of patience over my honesty on that. And I realize that you're not able to see the pieces of your puzzle, right? In the same way that I have to rely on experts in other arenas because I don't have that experience. There's no amount of reading I can do that's going to make me an expert. It just doesn't work that way. You have to gain it through experience. And that's how you see how everything works together. Mm-hmm. And that's kind of one of the hard things is there's a lot of nuances. And so people often are like, oh, well, you're not sure. And it's like, no, in my head, I'm going through the 10 different scenarios and all the nuances and how those have to play out for something to work. And so overly simplifying something is great for a sales tactic, but in reality, it's not that simple. Mm-hmm. And it's hard because we know simple sells, but it also leaves a lot of people frustrated. Mm-hmm. So I'd prefer to be honest and lose some people that I could have helped than overpromise and have people frustrated on that side.
I think one of my favorite things is seeing you with your whiteboard and just putting all the pieces on there. Like
correct. Yep.
You get it.
Yep. I love putting together the pieces of the puzzle and being like, here's what's going on. Here's what's connecting with that, and that. But that's what the education I've sought out, you know, it's why, like, hey, if you're required to do 20 hours of continuing education a year, I do a minimum of 100. I've done upwards of 400 a year because once again, it's, even though I help the majority of patients I see, it's that small percentage, it haunts me. And so I'm always trying to see what are those little gains that if I can find it, I can help people, you know, and I've been led down paths that didn't end up working for patients, you know, and I've spent money. So I understand what it's like to do things and not to be sure if it's going to help because you are spending money. And I've done that plenty in my education, you know, but it was a path I needed to get me to where I am today. And there's going to be more of that in the future as well. It's just bound to happen.
Yep. So, well, I think that's it.
Okay. All right. This was fun and may not ever do one of these again. So.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman 5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have and should seek the assistance of their healthcare professionals for any such conditions.